Understanding lupus, the body in conflict. Lupus is a chronic autoimmune disease. In simple terms, this means the body's immune system, designed to protect us from harmful invaders like bacteria and viruses, mistakenly attacks its own healthy tissues and organs. Imagine your immune system as a vigilant army, mistaking your body's cells for enemies and launching an attack. This friendly fire is what leads to the inflammation and damage characteristic of lupus. This chronic condition can affect various parts of the body, including the joints, skin, kidneys, heart, lungs, and brain. The severity and specific symptoms of lupus can vary greatly from person to person, making it a complex and often challenging disease to diagnose and manage. While there is no cure for lupus, understanding its nature and available treatments is crucial for empowering individuals to live full and active lives. Lupus is often called the great imitator because its symptoms can mimic other health conditions, making diagnosis difficult. It's important to remember that lupus affects each individual uniquely, and no two cases are exactly alike. This makes a personalized approach to management essential, tailored to each person's specific needs and experiences. The many faces of lupus. Recognizing the symptoms. Lupus can manifest in a wide range of symptoms, often making it tricky to pinpoint. Some of the most common signs include persistent fatigue, joint pain, and skin rashes. Imagine feeling constantly drained no matter how much rest you get. This overwhelming tiredness is a hallmark of lupus and can significantly impact daily life. Joint pain, particularly in the hands, wrists, and knees, is another frequent complaint. This pain can be accompanied by swelling and stiffness, making everyday activities challenging. The skin often bears the brunt of lupus as well. A butterfly-shaped rash across the nose and cheeks is a classic sign, but other rashes can appear on the face, arms, or other sun-exposed areas. These are just a few of the many faces of lupus. Other symptoms can include chest pain, shortness of breath, hair loss, mouth sores, sensitivity to sunlight, and even seizures or psychosis in severe cases. The unpredictable nature of these symptoms, which can flare up and subside over time, adds another layer of complexity to living with lupus. Unraveling the mystery causes and triggers. Despite decades of research, the exact causes of lupus remain an enigma. However, scientists believe that a complex interplay of genetic predisposition, hormonal imbalances, and environmental triggers contributes to its development. Think of it as a puzzle, with multiple pieces, each playing a role in triggering the immune system to malfunction. Genetics undoubtedly play a role, as individuals with a family history of lupus are at an increased risk of developing the disease. However, having the genes doesn't guarantee you'll get lupus. Environmental factors, such as exposure to sunlight, certain infections like Epstein-Barr virus, and even stress, are thought to act as triggers in genetically susceptible individuals. Hormones, particularly estrogen, also seem to be involved, as lupus is more common in women, especially during their childbearing years. This suggests that hormonal fluctuations may contribute to the immune system dysregulation seen in lupus. While we may not have all the answers yet, understanding these potential contributors is crucial for developing effective prevention and treatment strategies. Section 4. Seeking answers. Diagnosis and assessment. Diagnosing lupus can be like solving a complex medical mystery. There's no single test to confirm the diagnosis, so healthcare providers rely on a combination of factors, including a thorough medical history, physical examination, and laboratory tests. Imagine a detective piecing together clues to solve a case. That's similar to how doctors approach lupus diagnosis. They'll ask detailed questions about your symptoms, family history of autoimmune diseases, and any potential environmental exposures. A physical exam helps assess joint health, skin rashes, and other visible signs. Blood tests are crucial in identifying specific antibodies associated with lupus, such as anti-nuclear antibodies or ANA. However, it's important to note that having these antibodies doesn't automatically mean you have lupus, as they can be present in other conditions as well. That's why doctors also consider your symptoms, medical history, and other test results, such as urine analysis, to check for kidney involvement, and biopsies if necessary, to make an accurate diagnosis. Section 5. Managing lupus, treatment and therapies. While there's no cure for lupus currently, Various treatment options are available to manage symptoms, prevent flare-ups, and improve quality of life. The goal of treatment is to suppress the overactive immune response, reduce inflammation, and protect organs from damage. It's like putting out spot fires and minimizing the impact of the immune system's attack on the body. Medications are the mainstay of lupus treatment, and the specific drugs used depend on the severity and location of the disease activity. Non-steroidal anti-inflammatory drugs, or NSAIDs, like ibuprofen or naproxen, can help relieve pain and reduce inflammation. For more severe cases, corticosteroids like prednisone are powerful anti-inflammatories that can quickly dampen down the immune response. In some cases, immunosuppressant drugs, which suppress the immune system more broadly, may be necessary to control the disease. These medications can be highly effective but also come with potential side effects, so close monitoring by a healthcare professional is crucial. In addition to medications, lifestyle modifications like stress management, regular exercise, and a healthy diet can play a significant role in managing lupus and improving overall well-being. Section 6. A New Dawn, Emerging Therapies and Hope for the Future. While traditional treatments have significantly improved the lives of people with lupus, researchers are constantly exploring new frontiers in treatment, and emerging therapies offer a beacon of hope for even more effective and targeted approaches. Among these promising avenues is hydrogen therapy, a relatively new area of research showing potential in modulating the immune system and reducing inflammation. Hydrogen, the smallest and most abundant element in the universe, has shown antioxidant and anti-inflammatory properties in preclinical and some clinical studies. Although research on its use for lupus is still in its early stages, some studies suggest that molecular hydrogen, administered through inhalation, drinking hydrogen-rich water, or taking hydrogen-dissolving tablets, might help alleviate certain lupus symptoms. It's important to emphasize that hydrogen therapy for lupus is not yet a standard treatment, and more research is needed to confirm its efficacy and long-term safety. However, the initial findings are encouraging, and it represents just one example of the exciting advancements happening in the field of lupus research. As our understanding of this complex disease grows, so too will our ability to develop innovative treatments that offer hope and healing to those living with lupus.